Hi, I'm a program coordinator with the Upper Midwest Telehealth Resource Center, a program of the Indiana Rural Health Association. And today we're going to go over some updates related to telehealth coverage in the region for the second quarter of 2023. We'll be covering the basics of Ohio Medicaid, updates to Ohio Medicaid, as well as some pending legislation in Ohio as of March 2023. If you have questions related to the contents of this video, please reach out to us at info@umtrc.org. Now for some of the basics of Ohio Medicaid. More than 3 million people in Ohio are covered by Medicaid through a network of more than 165,000 providers. Ohio Medicaid is housed under the Ohio Department of Medicaid. Now we'll touch on automatic enrollment changes. Due to the upcoming end of the public health emergency, federal legislation has dictated an end to automatic enrollment, as well as certain eligibility considerations that were changed during the COVID-19 public health emergency. Ohio Medicaid resumed normal operations on February 1st, 2023. This will cause some Ohio Medicaid members to be disenrolled from the program, with the first round of termination letters being mailed to those who are no longer eligible beginning in April 2023, so this month. To prevent this from happening, beneficiaries should keep their contact information up to date at benefits.ohio.gov. We'll go further into Ohio Medicaid automatic enrollment and some associated changes in a future slide. This future slide, actually. So to expand on the end of continuous enrollment, related guidance was issued on January of 2023. The guidance highlighted is the following. So in March 2020, the Ohio Department of Medicaid made a number of operational changes to its Medicaid program in response to the COVID-19 public health emergency. So these changes included taking advantage of the flexibilities offered to states, such as increasing service limits for home and community-based waiver services, expanding telehealth, and adding family care isolation centers as a nursing facility benefit. And that's just a few, there are more. So additionally, with the passage of the Family First Coronavirus Response Act, the federal government provided states with a 6.2% increased federal medical assistance percentage. In exchange, states were prohibited from disenrolling members from Medicaid, even if they were found to be ineligible. This was to ensure members did not lose vital healthcare coverage during the pandemic. In December 2022, Congress passed the Consolidated Appropriations Act for 2023. Per the CAA, the continuous coverage provisions that prohibited states from disenrolling members from Medicaid will expire on March 31st, 2023. And as a result, states will once again resume routine eligibility operations. So Ohio resumed its normal operations on February 1st, 2023. This will cause some Ohio Medicaid members to be disenrolled from the program, with the first round of termination letters being mailed to those who are no longer eligible beginning in April 2023. Given the termination of the continuous covered provisions, it's critical that Medicaid members take the necessary steps to update their contact information, respond to requests for information, including renewal packets, or to transition to other coverage if they're no longer eligible for Medicaid. So that's some information related to the continuous enrollment changes from Ohio Medicaid. So as of now, there has been no specific guidance or bulletins provided around Ohio Medicaid and telehealth at the end of the public health emergency. You can see the CMS bulletins and guidance for more information on a larger level, but if Ohio releases any information that we think is relevant to our audience, we will be sure to get that to you prior to the end of the PHE. So far as Ohio private payer goes, the largest private insurer in Ohio is Atena. Questions about private insurer coverage after the PHE and telehealth should be directed to the insurer themselves, as questions will vary depending on the state, the type of coverage, and the service being discussed. And the answers will change from plan to plan, from person to person, from service to service. So that is something that should be addressed with the insurer themselves. So there are numerous pieces of pending legislation related to telehealth in Ohio right now. A full list of these codes can be found on the Center for Connected Health Policies legislation tracker. So a few that have either been introduced or have had movement recently are listed here. So SB 90 is to join the Social Worker Licensure Compact. SB 28 would enact the PA Licensing Compact. And House Bill 163 or 136, excuse me, would authorize the operation of remote dispensing pharmacies. So these are a few of the current pieces of legislation that you should keep an eye on related to telehealth. So some upcoming Ohio events. So the Ohio Association of Community Health Centers, so the OACHC, their annual conference will be happening this May 2nd and 3rd. Also, the 2023 Ohio Rural Health Conference will be happening August 3rd and 4th. So this year, the Upper Midwest Telehealth Resource Center will be sponsoring a track at the Indiana Rural Health Association's annual conference on June 13th and 14th. So please feel free to register today to connect with other telehealth professionals and to see some really great presentations about trending telehealth topics such as RPM and AI. You can visit our website at umtrc.org for more information or to register now. So if you have more questions that weren't answered by this presentation, please feel free to reach out to us via email at info@umtrc.org or at any of the other avenues listed on screen right now. Also, feel free to connect with us on social media to stay connected and updated on all the latest in telehealth news and updates. Thank you for your attention today. Please feel free to reach out and contact us with any further questions or concerns.